Ready? Okay. Good afternoon. Today at the Butte Civic Center, more than 2,200 people are receiving their second dose of the COVID-19 vaccine. Also today we have achieved in a sustainable way 2 primary metrics related to the COVID-19. After months of managing this virus, we can now get back to some state of normalcy. Butte-Silver has been tracking low COVID-19 infections and has seen a steady positive performance in various metrics. The local health department, along with SCL Health and Southwest Montana Community Health Center, have successfully established a sweeping vaccination program. Effective tomorrow, Wednesday, March 24th at 8 a.m., restrictions regarding occupancy caps will be lifted and all businesses will move back to normal business hours. A local mandate regarding face coverings has also been rescinded. I said during my campaign for the office of Chief Executive and in the early days of my new administration that our response to the COVID-19 pandemic would be to support our Health Director, Karen Sullivan, the Board of Health's restrictions placed on the community, and that this would be a top priority. Today we celebrate the efforts of our citizens and our businesses that were on the front line of adhering to the restrictions. On reflection of lifting restrictions, nearly 1 year since the pandemic first hit, Butte-Silver, the state of Montana, and the nation, we have earned our reopening. It has been tough. Our citizens have been frustrated. Our loved ones have sheltered at home, and many of our businesses have really suffered. Tragically, we have lost 82 of our residents to this virus, and today we remember them and hold them close to our heart. Despite these incredible challenges, we reopen. It feels good. It feels good that we can do this. After the surge in November and restrictions were put back in place, we have stayed the course, and now we are able to celebrate the sacrifices the citizens and businesses have made by lifting these restrictions. Between now and April 1st, Butte-Silver will see many more people vaccinated, and after today's clinic, an estimated 18,577 total doses will be administered. The key for us keeping our numbers low will be the success of the vaccine program and the willingness of our citizens to get the vaccine. Is there unanimous agreement to reopening? No. I'll be blunt about it, and I know that all the citizens of Butte would agree with the reopening plan, and I understand the concerns of the citizens. But I am confident in our health department to keep the community safe, and I think that the citizens of Butte are on the same page. I know that the overwhelming consensus is that we have sacrificed immensely as a community and that there is COVID fatigue among our citizens. My main concern will always be for the citizens of Butte-Silver and the safety and well-being of our businesses and community. Our community's continued practice of using caution is very much appreciated. We have been in this together, and tomorrow we'll come out of this together. In the coming weeks, we'll be rolling out a vaccine campaign to encourage our citizens to get vaccinated. Thank you for remaining safe in the coming days, and please consider registering for your vaccine as soon as possible. I thank you for all the efforts that our community has put into this, and we're going to move forward in a safe, practical manner, and so we wish everyone safe and happy health. And I'm going to turn it over to Karen Sullivan.
Good afternoon, and it is a good afternoon. After a year of having our lives taken from us, basically, by this awful, horrific virus, today we are announcing achievement on various metrics that we've been following in regard to our ability to manage the COVID-19 event. And I can convey to this audience today and our community that we have achieved these metrics successfully, and therefore we recommend, as a health department staff and the Board of Health, to lift and rescind the restrictions that we've had in place for months. The two primary metrics that we have been following are our test positivity rate. In other words, the rate of people who test positive for COVID at any given time. And since January, we have had desired performance on that. And our test positivity rate today stands at 4.5%. We have wanted that to be below 10%. Additionally, a primary metric that we have been following is COVID-19 cases per 100,000 population. We have wanted that below 25 for months. And today, for 3 weeks running, we have achieved being below 25. Today is day 21. And the Board of Health agreed if we should meet that metric along with the test positivity rate, our restrictions would be rescinded. What was being deliberated was the continuance of a mask mandate, and after much discussion with Board of Health staff and the Board of Health chair, Health Department staff and the Board of Health chair, we determined that our business community has worked for a year and taken the burden of this virus onto its shoulders. They have been at 50%, well, they were closed to begin with, and then they were at 50% capacity with an early closing time of 10 p.m., and then we moved them to a 75% capacity with a 12:30 a.m. closure. Additionally, they became the COVID police in our community. They really were responsible for policing their clientele to ensure that they were meeting the COVID mandates established by the Health Department and the Board of Health. In much discussion, we have determined that the business community has burdened enough, and we would like to ask the general public now to share that burden and take on the responsibility of having personal responsibility for wearing a mask on your own volition. And so that's what we are asking for the community to do, take the burden off our businesses and put it onto our own shoulders and try to do the right thing to help us manage the COVID-19 event. COVID is still present in Butte-Silver. We continue to test our wastewater at Metro Sewer. The name of this company that tests on our behalf is called BioBot. They're a Massachusetts-based company that really began in their formation testing opioids in wastewater and helping communities throughout the country manage their opioid crisis. When COVID hit, BioBot thought, well, we can test for the virus as well, the SARS-CoV-2 virus, and it has been very effective nationally in helping communities to determine what they might have on their hands in regard to the presence of virus in the community. We have tested over the duration of the event, and by golly, in mid-November when BioBot tested, the sample taken at Metro Sewer was found to have a higher concentration of the SARS-CoV-2 virus than 99% of the locations throughout the country where they were testing. Now, the staff at Public Works and Metro Sewer took another sample about a week ago. We got that sample back, and the virus is in much less concentration at Metro Sewer, being a confirmatory indicator for us that COVID-19 is still present but manageable. We are asking the community to do its part in the continued management of the COVID-19 event. That would be agreeing to be vaccinated, which I will convey in my humble opinion but professional background, that it is a safe, efficacious method of preventing from getting sick. And tell your friends and family to do likewise. and then to practice the non-pharmaceutical interventions that we have been preaching for a year, i.e. keeping your distance from others, wearing a mask in public places, washing your hands, and just being generally cautious of the virus, which remains in Butte-Silver. The news release that we issued yesterday indicates that last epidemiological week, we have our epi weeks from Saturday through Friday every week. Our cases were up from the week before. I'm happy to report to you today that our cases are way down this week. And we are taking that as a bit of hope going into our epidemiological week, that we will have fewer cases this week than we've had since early on in the event. I cannot convey, along with our chief executive, how appreciative I am of our community, especially the business community, and their contributions to our management of COVID-19. Thank you.
And so we appreciate everyone being here, and so we'll take any questions that anyone may have in consideration of our reopening plan. Yes.
Thank you. Do these decisions have anything to do with the new proposal for the American Rescue Plan Act that was signed earlier this week?
Our considerations were based strictly on the metrics that we had here in Butte. We've been in discussions for a number of weeks of, once we hit the metrics, where we're going to move to. For a while, we were thinking that mask mandates should stay in place, and being the culture and people's resistance a little bit towards masks, we did not want it to be a confrontation. We wanted it to be more of a celebration of lifting these mandates and putting it back on personal responsibility, as the governor has kind of expressed here locally. That's what he would like to do. I think that we have neighboring communities and stuff, so the message is mixed throughout the state. So we're going with belief that putting personal responsibility onto the citizens is the right thing to do. We also ask our citizens to respect the businesses that are requiring mask mandates. Some of them are larger corporations that are doing it nationwide. So we're asking that our citizens respect the wishes of the local businesses and what their mandates may be in those particular businesses.
Ma'am, I'll add to that. I believe you're talking about the proposed amendment to House Bill 632 and the recommendations contained in that amendment. We're very well aware of that amendment. We have talked about it since it was proposed, and we don't think that amendment will succeed. In fact, we're pretty sure that it will not. And so, given that it was, while we have it in our knowledge base, we're not worried about it succeeding. Additionally, I think the talks that we've had as of late is that continued concern that our economy get back going. And, we've even done research into areas like Michigan and their reopening plan and adopting some of the ideas there. And we feel going halfway with our community was the way to go and the right thing to do for Butte-Silver.
Any other questions?
Hey guys, Michael with the Montana Standard. You said there's been a lot of discussion regarding the mask mandate. Did it go to a vote in the Board of Health? And if so, why or why not?
I can say that it did go to the Board of Health. I'll let Karen answer that because she's been in closer communication with the Board of Health.
Michael, it was more a discussion with the Board of Health chair. What we were really discussing with the Board of Health is what metrics would we have to reach to rescind the mask mandate. And we determined that we were deliberating 600 doses per 1,000 population would be our tipping point. Today, we'll probably go over that with 2,000 people being vaccinated. So we hit the metric that we had mentioned. And since we were rescinding the restrictions today, also rescinding the mask mandate made sense since that metric would have been met.
And just to be clear, are we talking about all restrictions for bars, casinos, the times, the closing times, as well as capacity? Is all that being lifted?
Yeah, so John, we are rescinding all restrictions as far as closing times. We go back to normal business hours that we have for all of our businesses. As far as capacity that in the businesses, that still remains true. I haven't really talked directly about large events that we may have. I think we will still work with the health department and John Rolich, and I'll let Karen speak to that a little bit on how we will kind of make sure that any large gatherings, that we will make sure that we still have are able to monitor and make sure that we're able to take care of that. But I'll let Karen speak to that a little bit more.
John, as you know, the health department in the Board of Health rules has been no mass gathering or large event has been allowed to proceed due to the virus. We were under a rule that said no mass gatherings of more than 25 people, and then it moved to 50. That rule has now gone away. And so I anticipate the community having a 4th of July parade. The Montana Folk Festival had to really do some foreplanning prior to their huge event, which brings 165,000 people to Butte, according to that organizer, George Everett. And George nor the health department could really see bringing 165,000 people to Butte this year. We just couldn't consciously or in good conscience have that happen. What we are doing, John, is making health department environmental division staff available to the community, whether you're planning a 4th of July parade or a wedding. We are at your disposal, so to speak, to provide consult on how you can carry out your event safely. So we'll continue to make that available to the community. I do want to say that the Board of Health has made very clear that if we go backwards and see that our metrics are moving in the wrong direction, these restrictions would be reversed. Now, in my belief, that would take some doing to go backwards. I do get concerned when I see that the trend line flattening nationally in regard to the decline of cases, that has stopped. That's very concerning to me. And of obvious concern to me is the variants that we see nationally and locally and statewide, and the ability of our current vaccine systems to combat the variants, let alone COVID. And so the Board of Health has made very clear that, if we go backwards, the Board of Health would establish a new rule that would re-implement the restrictions so that we can keep the community safe. So a note of caution there to everyone that these could go the other way.
I know you didn't have, but do you feel like your department was put under any kind of pressure to move forward? I mean, business community, even the government. And I'm asking you.
John, we follow the metrics, and I think Butte-Silver Bow really was stringent on that. And so it was put out early and was we let the public know what those metrics were, what the parameters were going to be, and when we would move back to full occupancy and business hours. So we didn't give in to the pressure. We understand the conversations that are being had in Helena, But that did not drive any decision that is being made today as we're reopening our economy really here in Butte.
I have another question about the mask mandate.
Sure.
Would you mind kind of explaining what's the economic benefit and what are the health benefits of, taking away the mask mandate?
You know, Michael, that's a good question, and I don't know if we could really equate that, in that question. But what I will say is it takes away some confrontation that is happening with our public, with our enforcement code officers and things, and the messaging throughout Montana, and I hate to say it, our neighboring states, people leave our community, and then they're faced with other places that don't have it. So we're going with the belief that personal responsibility is the way we can move forward. We encourage people to continue to wear masks, but we know that there are people out there, just like there's people out there that are resistant to taking the vaccine, that we want to deal with, and we want to go through an educational program to educate them about what the value of wearing masks, what the value of vaccination is going to be for our community, and where we're going to move to if we're able to have success of getting about 80% of our population vaccinated.
Michael, I wanted to add that we have been watching Flathead County and Yellowstone County. Those are two populous Montana counties that have rescinded every restriction. I want to say Yellowstone County did that toward the beginning of the year. I cannot recall when Flathead County did that. Their outcomes are pretty good. In particular, the cases per 100,000 and their positivity rate are two primary metrics. So we have been watching that, and they're doing okay. So we felt that, joining that party would be all right. In addition, I want to go back to the Board of Health for a moment. The Board of Health rule regarding our restrictions was adopted in, I want to say, December, and then it was revised in early February to allow for the 12:30 a.m. closure time. The Board of Health rule really states that if we could meet the two primary metrics, the restrictions would be rescinded. And so there's no outlier in the Board of Health rule that distinguishes the mask mandate from the other restrictions. So we felt, we didn't need a Board of Health meeting, that if we met the metrics like the rules said, we were okay to move forward on the mask mandate. So I feel confident from a public health standpoint that as people are getting vaccinated, and that we urge the public to continue to take precautions, that we'll be okay. But again, if we're not, in reverse, we do have mechanisms that we can put in place through a new board rule.
Quick follow-up. It's my understanding that the mask mandate was not included by the Board of Health within the restrictions that would be rescinded, sort of on purpose, as if it would require separate consideration. I mean, do you think that it could be catching the public off guard, given that what we've heard from the Board of Health in the past, that the mask mandate would be included without a separate discussion or a separate vote?
I think the Board of Health really listens to health department staff, particularly my management staff. And when we look at our metrics and the metrics being met, we feel okay about this. The mask mandate, if you read the rule, is right in there with the other restrictions. So the Board of Health has been bandying about, if you will, to continue the mask mandate, but upon health department staff recommendation, they opted to go this way. We know the economy has been impacted by COVID. Former Chief Executive Palmer And that county COVID team has continued meeting under our new Chief Executive Gallagher. And on that committee is Karen Burns, who is the Economic Development Director for our county. I present pretty frequently to the small business community, relaying to them what metrics we follow and why we think the way we do. And so the business community has not been separate from our decision making. We are in tune with the effect it's had. And that's why our outreach to the business community has been occurring quite often. I know that the chief executive and the sheriff met recently with the local tavern association. And so while we're trying to beat down COVID, we are also trying to pay attention to the economic impact, but that is not driving our decision making.
When does this all go into effect?
So as I stated in the beginning, that this will go into effect at 8 a.m. on tomorrow morning. So Wednesday the 24th, we will be having the mask, or we will be rescinding all of our restrictions here locally. So the question was, are the schools going to still do online learning, or are they open? The schools have been open throughout most of the time here. They've offered online learning throughout as well. I commend the school district for their efforts, and the school district can also put whatever restrictions they would like within their own district, or at Butte Central, Montessori, Ramsey School District. They're able to hold on to whatever restrictions they would like to do. But I would like to add that they have been incredible when most of the nation has been closed to students being back in school. The school district, the Catholic school, and the educational community have been fantastic on keeping kids able to go to school if they choose, or have the option of doing online learning. So the partnership that we have had throughout our community has been fantastic, and we encourage the school district and their leadership to take whatever precautions they would like to do as well.
JP, are government buildings going to still require masks?
Because of the lifting of the mask mandate, and that those are the restrictions within, we were asking people, we are not going to require people in the government buildings to wear masks. We are going to continue to encourage mask wearing in government buildings. Again, we're emphasizing personal responsibility. And we know that masks make a difference. Nobody here is trying to hide that fact, and has made a difference in the numbers. And so we understand that. We believe in the science that goes along with COVID-19 and the pandemic. And as Karen alluded to, we know that COVID-19 is not eradicated in our community. The pandemic is still here. We understand there is some risk to this, but we believe we're moving forward as safely as we possibly can, and listening to the citizens and to our community, and following the metrics. I can't emphasize that enough, is that we follow the metrics, and we can take pride in that Butte didn't bend when a lot of other communities did. And I think this is the time and the place for us to move forward and lift the restrictions.
What about meetings for council and commissioners?
With the meetings for the Council of Commissioners, we will be meeting with Madam Chair about when we can open that up. I'm looking at probably the beginning of April that we will move to open up our meetings again, unless the metrics move for us. But we don't anticipate that, so I'll be meeting with Chairman Shaw, and we will make a determination that we'll probably open that up in April.
If a business decides to enforce a mask mandate, how will that be enforced in the county?
businesses are able to put a mask mandate. They have the right to put restrictions of their own on there, just as anything else. And as we said, some of the businesses have through companies nationwide have restrictions, and so they are enforceable, and they could call on local law enforcement to come and help them remove somebody if that was the case. You know, I think a lot of the things that we see, Michael, are how hard it is for a lot of local businesses to enforce with their employees themselves as people walk in and out of their businesses. And so I think this allows a little bit of flexibility to them as well, and a little less confrontational. You know, and so that's some of the things that you know helped us make some of these decisions too, because there's been, you know, a lot of, I wouldn't say not locally a lot of confrontation, but you can see throughout the nation where people are really passionate on one side or the other when it comes to this issue. So it may allow for a little bit of you know, less stress when not having to enforce the mandate.
Yeah, I guess if you think about a grocery store and they decide that they want to enforce their own mask mandate, I mean, do you think not having a government mandate in place is going to reduce confrontation or increase it in that scenario?
You know, in places that I've seen it where they've done it, where restrictions have been lessened, they put people at the door to enforce their rules. And so they kind of stop it at the door. And so, you know, I can't speak to that because we have not had to address that concern locally. But I believe that a lot of the national chains that are there, they have people at the door. So if they have a policy, you know, they will be responsible for enforcing that. And at the national chains that I've seen, they're enforcing that rule right at the door rather than inside the business itself. Any other questions? Well, I just want to say thank you. I want to thank the citizens of Butte-Silver Bow for their diligence and adhering to all of the restrictions that we had prior to this. I want to thank the Butte-Silver Bow staff and everybody that this pandemic has affected. It's been incredibly hard for everyone. And I can speak on a personal note. Just this last Sunday was the first time that I was able to have my mother leave her residence, which she's in one of the assisted living facilities here in Butte, and spend a day and, you know, have dinner with her and give her a hug. So we are moving forward. There is a lot of progress, and so, you know, I want this to be a celebration, not you know, something that's going to cause a lot of confrontation or problems within our community. And again, we know that there's people that may not agree with this, but those people that do not agree with it, please follow your own restrictions, follow your own comfort level, do the things that make you comfortable in your daily life. We can all take our own precautions. So with that, thank you everyone for today, and look forward to speaking to you again.